Chapter 17 in your Carlton Adler text discusses the pathology problem in terms of radiographic technique. We often need to alter our radiographic technique according to the pathology condition that our patients have. So as we go through each of the following chapters in our Bontrager text talking about specific diseases, I'd like you to always refer back to Chapter 17 that we'll go over now so that we can connect that with what we need to do with our technique each time. There are two types of pathologies, additive and destructive. Additive means that the body tissue is increased in thickness or atomic number, and therefore it is going to absorb more x-rays and attenuate more, so that we have to increase our radiographic technique for these conditions. And then the opposite would be destructive condition, and that's when the body tissue decreases in thickness or decreases in effective atomic number. That means that it is going to absorb less of our X-ray beam, and we have to decrease our technique for that. Your text does give you some examples for those, and it talks about how much you need to decrease your technique. Now, I do understand that in the digital world that some of this is taken care of within the system. The algorithms will take care of it. But all of our KVP choices still stand even in digital. We should still select the KVP that's proper to penetrate the part and adjust the MAS to give us the overall proper exposure. So this means with destructive conditions such as emphysema, I don't want to use 120 KVP if that's the norm. I would rather go down to 100 KVP and make up for the MAS if possible. If you do use 120 KVP on an emphysema patient, you are over-penetrating the part. So keep in mind, some of those rules in film screen do apply in the digital world. They do have a list of a few of the additive and destructive conditions on table 17-1 in your text, so I urge you to go over those, kind of commit those to memories, or at least understand why they are in the columns that they are. They do go into specific conditions of the chest and abdomen and so forth, but in the PowerPoint continue, there are a bunch of examples of the pathologies. So please review all of those that I have listed in the next few slides. And there's also a worksheet that goes with that, so please complete that and submit the worksheet. And then contact me if you have any questions.